Greetings, and thank you once again for spending a few minutes to learn more about what's happening at FHN as it pertains to COVID-19. Today, I'm very pleased to be able to welcome back our expert infection preventionist, Margie Kochsmeier, to help share some more information and keep our community updated, as well as I can share some updates with what's happening here at FHN. So once again, thank you for spending time to listen, and thank you, Margie, for spending time and being willing to share with our community.
A mutation means that a virus has changed itself or replicated. Each time it does this, it can become stronger. This is normal when a virus circulates in a population. Mutations then are variants of the original strain of COVID. COVID variants have many, many strains, and one of those is the Delta variant that you've heard about on the news. Immunizing a population and providing herd immunity is our way of stopping this from spreading. If we get everybody vaccinated, it leaves the virus nowhere to go. This happened with the first SARS. We didn't see SARS come here the first time. It was stopped pretty early. The more opportunities we give for a virus to continue to circulate, the more it will change and mutate, and it will become stronger. The Delta variant is a concern because it is different from the original COVID virus. It overpowers the immune system faster. It is more contagious. People have had more severe symptoms with it, and we've seen more hospitalized persons. Someone has a history of having COVID and they have antibodies, they won't have antibodies to some of these variants. They won't have protection. So vaccination means that you will have some protection for some of the variants that are currently circulating, and know that if you've been vaccinated, you potentially could be a carrier without symptoms to people that are vulnerable. We are still seeing this as a serious illness, and we can't forget that we still have people that are dying from this disease. We are saving lives through early treatments and recognition of the virus, and this is what's helping people to survive. Many hospitalized people that we're seeing right now are unvaccinated and they've had no protection. There's some, a few, that are vaccinated that have been positive. They've been able to manage at home in some cases. It's rare that a vaccinated person is hospitalized, but it does happen. No vaccine means no protection. The benefits of vaccination is to prevent an illness for those who would have been sick without it. A breakthrough infection is in COVID. They get the COVID virus, but they're vaccinated. It is rare, but it can happen. With people that are vaccinated, the illness isn't as severe. We don't see as many deaths in vaccinated people. A lot of them can manage at home. So vaccination will protect them from serious illness. Remember, no vaccine is 100%. Vaccinations provide protection. We know that wearing a mask reduced the positives that we saw. Our vaccination was free. It offered protection, and we thought that we were on our way to ending the pandemic. When the majority of the population didn't take the vaccine, we didn't reach our herd immunity, and the virus continued to circulate. So we're going to have to continue some of the precautions to help save some lives. Kids are going to go back to school. There's going to be kids that have symptoms or not have symptoms that can transmit to vulnerable people. With the strains circulating in unvaccinated children, we know that kids that are under the age of 12 can't take vaccine. Kids are going to need to take those additional precautions, the hand hygiene, the distancing in the classrooms, opening a window to get some air into the room, and not make the virus just so concentrated in the room. The best protection for us is to be vaccinated. We want to keep our businesses open and our kids in school. Our best defense at this time is to stop the spread and to stop this from mutating, and it's continuing to circulate. We know that we have a history of protection through vaccines, vaccinations for polio and smallpox. Smallpox was our first vaccination, and it's been eradicated, meaning that you don't see it anywhere in the world. Polio is close to eradication. Vaccine leaves viruses nowhere to go. For influenza or COVID vaccine, we're not going to see eradication with this. We may have to continue to get booster shots for this. What our vaccinations do is they lessen our chances of becoming critically ill. COVID offers 95% protection with vaccine. There's boosters that are in progress right now. Maybe we'll need an annual vaccine. That has not been confirmed yet. Knowing that when we have vaccine, we have some protection for some of the variant strains that are circulating. Again, our best defense is to stop the spread and to stop the mutation. The more mutations we have, the less effective vaccines are going to be for us. We need full vaccination. That means 2 Pfizer or 2 Moderna or 1 Johnson & Johnson to be fully vaccinated, and it takes 2 weeks after each of those last doses to become fully vaccinated. When the booster comes out, we're going to have 6 to 12 months after our last vaccination from either Pfizer or Moderna or Johnson & Johnson before we can take the booster. Kids may need to wear masks this year for school. Remember, not everyone is vaccinated. Anybody under the age of 12 isn't going to have vaccine yet for some time. So what the vaccine does is the masking is going to do is lessen the exposures in school. Our goal is to prevent the illness. We want face-to-face instruction this year for our kids in school. The protective measures that we're taking can make this happen. We saw an increase in positives this summer that we weren't expecting. We thought people would be outside, they wouldn't be in close contact, and we would see our numbers continue to fall. But what happened is masks were removed, too many people were unvaccinated, and the virus continued to spread. And it changed, and it mutated, and it became stronger. So we're going to have to wear masks as necessary. Use good ventilation. Classrooms can open windows, school buses can have the windows open at home if you have people visiting. Avoid crowds and indoor places where people can be in close contact. The increase in the variants that we're seeing means that it's important for us to be vaccinated.
I'm very concerned about it causing a surge of cases in our area. In fact, we're already seeing that happening through southern and central Illinois. And we know that there is an increased prevalence already upon us and that those numbers are going to continue to grow. And this isn't just a statement of opinion or what I think. A few weeks ago, we were pleased to be able to share that we had no COVID-19 positive patients in our hospital, and that was the first time since the beginning of the pandemic. Currently, we've seen that number starting to climb once again. As of the recording of this video, we have 4 positive COVID-19 patients in the hospital, which is up from the average of 2 that we were seeing just a couple of weeks prior, as well as one of those patients fighting for their life on a ventilator right now. So we're starting to see an increase of positivity rates throughout our community as well. We've been able to get confirmation from the state laboratory where a lot of our testing samples are sent to, and they test it for the specific strains. However, they don't test every sample for different strains, but we have had confirmed cases of Delta variant in our area as well as in our hospital. Well, I'm pleased to be able to share that the vast majority of our staff and providers are already vaccinated. For the minority of individuals who are not yet vaccinated, we are requiring in-person mandatory education with a physician and our infection prevention staff to be able to discuss the facts, scientific-based approaches, and debunk some of the myths that are out there about vaccinations. where we know that there are some very valid medical reasons why somebody should not get a vaccine. There are also some religious exemptions. So what we're doing is highly encouraging all of our staff to receive the vaccination, and at the minimum they need to attend this education. Part of this education talks about both the benefits and the risks, and how the benefits really outweigh the risks of vaccination. I myself am vaccinated and am a strong proponent. We know for a fact that vaccinated individuals have a lower incidence of severity of illness as well as potentially death. That's pretty important. As well as when we look at transmissibility, or the ability to spread the virus, we are learning that even with vaccinated individuals, especially with the Delta variant, that vaccinated individuals can still spread COVID-19. And that's important to note, that vaccination is not a one-size silver bullet that's going to fix everything for all of us. What we do know is that it helps to keep individuals well, and it helps to keep individuals healthy. With that said, what we know is the most effective thing that we can do is the appropriate use of personal protective equipment. So part of that education session is making sure people are doubling down on our diligence to maintain proper hand hygiene, proper use of personal protective equipment, making sure that when we know we have COVID-19 positive individuals, that we're isolating them or we're separating them from other individuals to control the chances of that potential spread, as well as enhance precautions during that time. We are doubling down and making sure that we are keeping our facilities clean and a safe place for patients, for staff, and for visitors that come to visit those patients. That's our responsibility to do, and we won't compromise on that. Where it comes to the topic of mandatory or mandates, I'd like to just take a moment to talk a little bit through that, because we've seen that in the media where major companies are sharing that they're making vaccinations mandatory for their staff. And what I'd like to talk about is what that term really means, because there will still be valid exceptions by law that employers need to adhere to. For example, some of the medical exceptions for people, as well as religious exceptions based on beliefs. When we say mandatory, that doesn't mean 100%, and there will always be some individuals for any company that says mandatory that will be an exception to that. This is why we feel that it's very important for us to make sure that we're educating people, encouraging them to take the vaccine, yet at the same time, more importantly, making sure that we're taking safe precautions such as personal protective equipment, hand hygiene, disinfection, sterilization, and distancing of those patients, including isolation. Making sure that we're educating individuals, if they're not feeling well, to get tested, and if they're testing positive, to stay home, to be able to isolate, so that we can control this and ensure the safety for all. Masking has always been, since the beginning of the pandemic, a hot topic and a subject of debate. And there's no one size fits all, or no one rule that applies to everybody. One of the things is trying to think about what situation are you going to be in. So for example, if I'm going to visit a high-risk individual in a nursing home, and I know that that person may have some ongoing health conditions, it'd probably be more responsible for me to wear a mask in order to protect that person versus not. The same way, if we have visitors coming into the hospital to visit patients, patients aren't in the hospital because they're doing well most of the time, and we want to make sure that we're protecting those individuals, so that would be another good place where a mask should be worn. When we're visiting different medical facilities or health clinics, again, we don't know what is the well-being or the health history of individuals that we'll come into contact with, so masking seems to be an appropriate step in order to provide protection for others. And once again, reinforcing that masking, while it's not an absolute, not 100% shield against spreading coronavirus, it does help reduce the spread. And using good judgment in the proper situations is probably the best way to decide, should I be wearing a mask or shouldn't I? And that's regardless of your vaccination status. In full transparency, I don't know, but we certainly do know that many of the vaccine manufacturers are working diligently to try and move that through as swiftly as possible. Where it comes to vaccinations for children, it's one of those things where we don't want to take any unnecessary risks, and we want to make sure that we've got good long-term studies that demonstrate the safety, but also that there's a good awareness of any potential adverse effects, including long-term effects. So while we're moving swiftly towards the development of a vaccine for children, we also want to make sure that we're doing our best to protect our most vulnerable population by making sure we truly understand what are the impacts of that vaccine and again, ensuring its overall safety to weigh that benefit versus risk ratio. I think it's a question that has come up quite a bit in different conversations, and trying to understand what is that FDA approval process is an important moment to take a little bit of a pause. Where we go through a full FDA approval, that takes much longer term studies. So by requirement is that the data needs to be over a longer term period. There is a lengthy application period and review period during that FDA approval or full authorization. Typically that runs about 10 months from when the manufacturer has applied for that approval. I believe Pfizer has applied for its full FDA approval on May 7th, and I know that Moderna and J&J are shortly there behind. But as we look back at that, even accelerating that process at a minimum of 6 months, there's still a lot of administrative review that has to be done. There's also some other implications from both a political and economical aspect that many don't realize. Once the FDA has issued full approval for a manufacturer or a vaccine developer, then the vaccines that are under emergency use authorization, there can be no more emergency use authorizations approved because that vaccine supplier has received full approval. So there's a product that is fully approved, and the FDA would say, again, here's a fully approved vaccine. That's the only vaccine that should be utilized during this time. That can create significant supply chain disruption as well. So as we're going through this process, it's important to take that time, but also understanding some of the other aspects that are more administrative in nature, and then also some of the implications of once that approval is released, if it's only released for one vaccine supplier, that has a ripple effect or another consequence to new developers or additional suppliers until they receive full approval as well. They simply can't. And so that's where the studies are being done, and that's where that longer term approach is really important for that full FDA approval and continuing monitoring well into the future. We know that there have been other products that were originally approved by the FDA that long term or later on there were some adverse events or consequences of longer term impacts where the FDA has actually revoked that full approval and took that product off the market. Now, we don't have any indication that that's going to be the case with the vaccines that are being developed now. However, there has been a history that over time we need to continue to watch and to look at things to make sure that we fully understand that. And because the vaccines are so new, we just simply don't have that history yet. What we've seen and experienced, and generally if a person is going to have a reaction to the vaccine, it's usually within the first few days. There have been some cases of where there's potential lingering side effects that have gone on as much as a month, but really the vast majority of adverse impact or long-lasting effects have been limited to those first few days in the majority of cases. As we talked about previously, with longer-term impacts, those are things that we're still continue to monitor and to learn more about as we get more history with vaccinations. But again, that should not be a reason to put off vaccinations. The CDC has recently come out with a statement that the risks do not outweigh the benefits. So the benefits of getting vaccinations significantly outweigh the risks of any short-term impacts or effects. Over the next few weeks, I would encourage people to try not to get caught up in the internet and the media, but really try and go to fact-based sources that are driven by science, that have a lot of empirical or a lot of data, not just select cases or one-offs, but really a lot of information. So seeking out those facts to be truly informed and understanding that as we're all dealing with this ongoing pandemic, is that it's not a political stance, is getting into the science, regardless of whatever your political leanings are, is understanding that this is having an impact on people's lives in many ways, not only physically, but also economically. So the sooner that we can move through this pandemic, the better for all of us. So the more we can do to control the spread, to be able to reduce the impact of COVID-19 and get back to focusing on other things, the better for all of us. Now, with that said, we should also go on living and making sure that we're taking time to enjoy the company of others, that we're taking time to support our local businesses, that we're doing things to keep ourselves well, such as eating well, exercising, and again, just enjoying good mental health is going to make an amazing difference as how we persevere through this, and then also how we actually come out of the pandemic. In Northwest Illinois, it is a great time to see a lot of wonderful things that are happening, partake in that, and support local, as well as making those appointments with your local healthcare professional as needed to make sure that you are fully capable and able to enjoy those.